Good afternoon, everybody. Welcome to Dr. Tom's Case of the Week, January 19th, 2021. Holy cow. Can you believe it? So check this out. Here's just a little bit of a teaser of what Dr. Hirsch is going to cover. Basically, he's going to be showing you all how Isolite works with multiple crown restorations. How are you, Dr. Hirsch?
Rolando, how you doing? Hi, everybody. Welcome to Tom's Tips on Tuesday. Great to be here. So today, what we're going to talk about is how to make some money in dentistry. Okay, how to be profitable. And the way to be profitable is multiple crown preps. As many crowns as you can do in one visit. It doesn't take a whole. Oh, I got a great story to tell all you guys. I'm sorry about that. You don't even know about this, Ro. So many years ago, I had a patient that needed a crown on tooth number 4. And so I told him how much it was going to be. And I went back in there, and I think my crown fees at the time were $1,000 at the time. And so I went back in there. God, no, I'm thinking I've got to. Yeah, okay. Yeah. So there were $1,000 at the time. So anyway, I prepped tooth number 4. And then I noticed there was some decay on tooth number 5, deep enough that it actually needed a crown. And so I told the patient, I said, Michael, I said, you need another crown on this other tooth here. And I said, do you have the time to do it? And he said, well, how much longer is it going to take? And I said, well, Mike, it's going to take about another 5 minutes to do this crown. And he's a financial guy. He says, so Tom, how much more is this going to cost me? And I said, well, Mike, it's going to cost you another $1,000. I said, I'm doing 2 crowns at the same time. It's going to cost you another $1,000. And he sits up in the chair and he looks me right in the eye. He says, Tom, another $1,000 for 5 minutes more work? How can you possibly justify that? And he really kind of took me off guard. And it took me about a second to think about what I was going to say. And without really missing much of a beat, I looked him straight in the eye and I said, Michael, it's pure profit. Just like that.
It's talent. And
he looked at me, and being a financial guy, and he said, okay, I can live with that. This is kind of a fun one, but let's get on to the point. Sorry, Rolando. So today what we're going to talk about is how to make some money in dentistry and how to do it fun and properly and safely. So here's the case that we're looking at. Radiographs, 15, 14, 13 were all kind of wiped out, and so was 12. So here you're seeing me put the Isolite in the mouth, and now I'm going to take off the crown on tooth number 12. The other crowns were all zirconia crowns. The next 2 were zirconia crowns. They were really a bear to get off, so we're not showing you the whole situation. So I sat down there. I made my slots in it, took my tanner to try and get this off and having a little bit of a trouble. You can see the porcelain chipping off of this, but it just kind of falls back there in the back of the mouth. And because it's back there, I don't worry too much about it. I just asked for a pair of cotton pliers and reached in there and just picked up the pieces, which I could have easily left, but I just kind of want to show this for the video that we're doing. Handed it to my assistant and then went right back to work trying to take off these 2 zirconia crowns, which was a lot of drilling to get those 2 off. Now, my assistant, who's got the free hand, she's kind of sitting there wondering what to do, so she did this. So here we go, filing off these 2 zirconia crowns. We're not going to show all of that preparation work.
And I noticed, Dr. Hirsch, you also put cotton rolls up here. So
yeah.
You can use cotton rolls, right?
Yeah, I put a cotton roll up there. Sometimes I say we don't need them. Sometimes we do. Clinically speaking, do what you need to do. I wanted his cheek up farther and out of the way. And so that was easy. So, we took these zirconia crowns. You can kind of see down inside the mouth, there's a piece of zirconia crown. I'm really not going to worry about getting that out right now, just to demonstrate the point of that we don't need to get that out. And now I'm trying to pop that off, and it's bonded on so well that I had a hard time getting it off. Went back in, pause it right there. That teaser that we had, back up just a touch, back up a little bit more.
Okay.
The teaser that we showed in the very first part of the video showed all those crowns and all those pieces of crowns collected to the back of the mouth, so I didn't worry about it. He had a lot of very deep decay on the distal of 14 and 15 and on the lingual of 14 and 15. So after I prepped it, it was really bleeding substantially. This is what I use to stop the bleeding. It's made by Ultradent. It's a Stringident X. This should definitely be in your armamentarium. It stops bleeding like right now. I mean, you scrub this into the preps, it stops bleeding right now. You can see we've done all that. And now I'm retracting the tissue. I've got all 4 teeth, retracting the tissue. I use Ultra Pack from the Stringident and a little Hartzell that I use. putting that in there really deeply. You could certainly go in there with a laser if you didn't want to use retraction cord. I never got into that. You know, I'm the old dog here, so I didn't really get into lasers all that much. A lot of you young guys, you say, what the hell are you doing that for? What a waste of time. So you young guys, you're going to be out there with lasers. The old guys, you're still going to be in there with retraction cord. And there now, everything is all retracted. We've got those 4 preps retracted. I built up the deep decay on number 14 right there on the lingual. And now we're going to get ready to image. And right before we image, we're going to remove all the retraction cord. This is what I use. This is KY jelly. Pause it for a second. Thanks, Ro. So I'll take a little KY jelly, which is really slick and slippery, and I'll put a little bit of that on my finger, and then I'll just put that right inside the mouthpiece, as you'll see me in a moment. I'll rub it on the tongue flange. I'll rub it on the cheek shield also. And did we miss the spot because we had me putting Vaseline on the back of the camera? So can you back that up for a second?
No, it's not. It was skipped out. But.
Okay, so it skipped out, but on the back of the camera, I put some Vaseline, and that way it slides really nicely and easily right across there. And you can see the imaging that we get. This is really a nice thing when you have KY jelly on the Isolite and you have Vaseline on the back of the scanner. It just slips around there really nice, and you just kind of push this up and out of your way. And those are the images that we got. And in time, I didn't put the whole scanning situation in there, but it's just really nice. And these you can make in the office. I chose not to make this in the office that day. It just takes too much time for me. So we just made a set of provisionals. This is another thing that you should get in your office, a steam cleaner, just to steam clean everything before you cement. It's made by Steeman, I think it is, but it's a great thing. And we took the provisionals. Another trick, Vaseline your provisionals on the outside. Your cement cleans off super easy. And we filled that up with some Tempo Sim, which is what we use, dried the teeth off. You can see there's all the bleeding is controlled. There's no hemorrhage at all. We put that in, we cure it. And here we go, you know. And not much more time than prepping 1 crown, have them bite down occlusion. Not much more time than prepping 1 crown. I prepped 4 crowns. Very productive. And why was I able to do this? The Isolite allowed me to do this. It kept the tongue out of the way. It kept the patient open, so I could just focus on exactly what I was doing. I didn't have the patient sitting up, closing out, spitting out, and swallowing, which was not.
For a clinician who doesn't have Isolite, how long would it typically take if they needed to, or if they were going to be treating those same 4 teeth and replacing those 4 crowns? And then how long did it take you?
God, Rolando, I don't recall how long it took me. Maybe an hour and 15 minutes, an hour and a half maximum. The hardest part of that whole thing was getting off the zirconia crowns. That was the toughest part. And so if you were going to do this, you know, everybody knows how long it takes them to prep a single tooth. It doesn't take a whole lot longer to prep 2 teeth as 1, and it certainly doesn't take much more time to prep 4 teeth as 1. The advantage here was that 3 of the teeth were actually already prepped. I mean, so I didn't have as much drilling to do on 3 of the teeth, and that was a nice advantage in redoing crowns. The disadvantage was I had to spend a lot of time getting the crowns off. They're really, if they're bonded on properly, and they're zirconia, they're hard to get these doggone things off. So, yeah, there's just give and take. There's just give and take.
Awesome. Well, I love the commentary. I love the fact that during the course of that, you can see multiple different things. I'm sure there are lots of additional comments in there. Folks, if there are things in there that you've seen that you want to ask Dr. Tom about, or you have comments about them or would like to ask, please let us know. If there are other cases that you're interested in, we're going to continue Dr. Tom's case of the week, and he's going to highlight different aspects of it and how the Isolite is used in that. As you can see, mouth was left open, pieces were falling down, no problem with the patient. Patient was very comfortable, and procedures really moves along well. So thank you, sir. Thank you.
You're welcome. I'm going to give you a little teaser maybe for next week. Next week, I might just talk next week without even showing a clinical video, or I might show a clinical video, but something that came up is when not to treat a patient. That'll be a teaser for you.
Awesome. Well, thank you, sir. Have a wonderful week. Thank you for taking the time. If you like this, please share it. If you have questions for us, or if there are other things you'd like to see, please let us know. Have a wonderful, safe rest of your week, and inauguration tomorrow is going to be incredible. And
It's going to be fun.
take care. And
Hey, everybody, thanks a lot. I hope I can give you some good information. I just kind of share the things that I found that make my life easier, that make everybody's life easier in the office, just how you get things done a little bit more rapidly. So take care, everybody. Thanks for tuning in. Bye-bye.